Meanwhile, health experts are quickly trying to respond to the growing Zika virus outbreak. It was just 2 weeks ago that we first heard of the virus. Now, President Obama is asking Congress for nearly $2 billion in emergency response in the U.S. and overseas. He talked about how that money should be spent on CBS this morning.
We're going to be putting up a legislative proposal to Congress to resource both the research on vaccines and diagnostics, but also helping in terms of the public health systems. But there shouldn't be panic on this. This is not something where people are going to die from it. It is something that we have to take seriously.
Zika is transmitted by mosquitoes, and it's believed to cause birth abnormalities in newborns. The virus has spread to at least 29 countries. 50 Americans have returned to the U.S. infected with the virus. And while the CDC has recommended that pregnant women not travel to impacted countries, local doctors and aid organizations told our Nina Moini that more needs to be done to help pregnant women already living in those areas.
In just a few minutes walking the Minneapolis Skyway system, 2 women told us they've been researching Zika virus because of travel plans.
Right now they're saying don't get pregnant for a month after, but maybe a little concern of, is that true? Are they going to find out in the future that, like, if you've had it at all, it could impact your kids?
I would never want to put my unborn baby at risk for even such a small percentage.
At 18 weeks along, Patty Wagner decided not to go on vacation to Mexico. She can't help but think of the mothers-to-be around the world who don't have the option to cancel a trip.
I grew up in a really small country, and I lived through 3 refugee camps, and I know what it's like to go through those struggles.
Each bug repellent is 7.5 ounces.
Minneapolis-based OBGYN Dr. Leslie Jager says women in some North, Central, and South American countries don't have easy access to birth control or even bug spray.
Get like mosquito spray that I can just go buy at Target right here.
Increasing awareness when you're not giving them the resources to be able to combat it almost is more difficult for these women.
Dr. Jager is working to bring these supplies to a clinic in Haiti as patients here at home continue to opt out of potentially dangerous trips, a wave that could hurt impacted countries' economies as well as the people.
If we can do all that we can to help these women, I think it would be awesome.
The Red Cross just began raising funds to spread relief and supplies around the world within the last week. They estimate as many as 4 million people in the Americas could be infected this year, Frank.
Yeah, and the scope of that I think might remind people of Ebola just on a worldwide scale, but I mean, at least we're not dealing with a fatal disease here.
That's right. The World Health Organization says Zika virus alone has never killed a person. Some people could have the virus and really not even know about it because the symptoms can be mild like the flu, but again, there is that risk for unborn babies.
All right. Nina, thank you.